Because going back to the scoliosis page,
Yeah.
you talked about it was like a loading issue.
Yes.
And then you also said something about like not training heavy weights then and just do calisthenics. Can we load it in the opposite directions? Like would still
The problem is that you're dealing with a neurological event also. So scoliosis isn't just a structural; it becomes neurological. It becomes neurological repetition.
But isn't there also rehab exercises that are
there are, the Schroth exercise method, for example.
Like idiopathic adolescence versus like adult scoliosis.
And that's interesting because you're not supposed to be able to go ahead and change a scoliotic curvature in somebody who's 60 years old. So there are other components, is there actual leg length discrepancy? Most of the time when you go ahead and you look at most x-rays in relation to scoliosis evaluation, 99% of the time they don't include the pelvic dynamic. They don't look at the pelvis at all. They just look at the spine. And they really should be looking at the pelvis. Because
I think
your question, the pelvic dynamic should be included and evaluated very consistently because there is typically, like I said before, at least one knee or the other that becomes degenerative, and most of the time those people will have that replaced, which is interesting. As far as the loading is concerned, like we talked about, the Hox gene could be a Hox gene component where basically the bone just shuts down genetically as far as its growth pattern, if you will, and they don't really know. Idiopathic scoliosis means they don't know, bottom line.
Yeah.
However, if you do have a pelvic dynamic that is problematic, you can actually, without any bracing whatsoever, stabilize the pelvis with a full-length foot lift, especially if you have 4 or more degrees or millimeters of variation between this and a sacral inferiority of one side or the other, typically going to be the same side as a short leg. You can actually see a curve completely be eliminated with a foot lift. It's kind of amazing. And then, of course, even with some of the patients that I have, again, because I've been able to track it with films, some of these people are 60, 70 years old and also at the same time have had rods and screws put in. And even with that, I've been able to see a lot of, those little areas that could be anywhere from, 15 to 3 degrees completely eliminated. That's not supposed to happen, but it can.
With the lift?
With the lift.
I've had people with like levator overactivation, they're always up. I'll have them sit on a foot wedge while they're in the gym and it balances them out, and then what the hell?
Yeah, but you got to be careful because scoliosis is interesting. It has, like I said, there's in excess of 40 different variations, and you're looking at compensatory reactions. And compensatory reactions also are a neurological component. So, you're dealing with, ribs that develop, and so the ribs will develop around the crooked spine. They don't develop like your spine did, where it's nice and tight and where it's supposed to be. They morph. So in reality, how long is it going to be until you go ahead and you change that? Part of it is, okay, when did the curvatures, come into play? And was it a developmental, a pre-adolescent kind of thing, or was it after, or was it injury, or was it surgical? You can have curvatures develop over all of these things. One of the curvatures that I was able to experience as a young doctor, because I'm kind of a tweener, I call it a tweener. I'm between all the 80-year-old guys and you guys. But I was able to see a lot of the last generation of people who actually were exposed to polio. So polio presentations have scoliotic presentations too because of the neurological shutoff that occurred because of polio disease. And so you see those same kinds of patterning in polio. And when I had graduated in 1997, they had actually had in Scotland a paper that was a relationship between the polio vaccine and scoliosis in the human condition. Well, that was out for about 6 months and it disappeared. Why do you think it disappeared? Big Pharma doesn't want you to have any qualms whatsoever about any vaccine, let alone polio, which we've been told that polio actually disappeared because of the vaccine. Polio actually increased, if you go ahead and you look at the records, increased after the vaccine. More people were put in iron lungs after the vaccine. So it's all been a lie. They keep perpetuating the lie. It's amazing. So polio was on self-eradication, especially over in Europe at that time. And it was on its way of becoming eradicated here through natural progression. But when they went ahead and gave it the shot, boom, blew up. So interesting things, when you go and you look at the whole story, but there's a narrative, and they just kind of say whatever they want to say. What were some of the other questions? Did I answer the ones that you had answered that one? Okay.
Sort of, because we were talking. I think my original question was like loading. If we were going to do because you said initially there's no exercises because even if it was a neurological type of exercise, it wouldn't still fix the.
So likely because it's already smushed. It's kind of like an ice cream sandwich. Remember we talking about that? When you take a bite of it, it's always going to be that smush. So are you going to ever smush it straight? Can you ever smush an ice cream sandwich back into its better position or its original position? It's always going to have a deformity. So could you try? Listen, it's one of those things. I'm not going to say it can't be done. It just hasn't been done. And nobody's looked into it to try and create that. So is there information out there to suggest that it has been done? No, not really. Are there exercises to help you manage it? Yes. Schroth exercises and things along those lines. The spine core exercises and things like that. It's worth a shot. You're looking at clear also. They do a lot of vibration. They do the seats, chairs like that. CBP does a lot of work on that as well. So there are things that you can go ahead and try and do the reduction. It just all depends upon when you get a hold of that patient.
It was because you did mention saying C2 goes laterality.
Yes.
When does that happen in any sport like strongman?
It's not really sport specific because in the general population I see it too. So if you've got a lateral curvature in there, it can be lateral dependent, and it can actually slide sideways. You don't really think of it like that. If you go and you look at it, it looks pretty tight,
I've
right?
never heard of it going those directions.
Yeah, but look, it can go that way. It can be moved sideways. Now, do you see that so much with C3? Not really, because it's kind of tucked underneath of C2. But it can rotate, and that's why I said I call that the Hidachi bone, or the fancy way of saying headache.
Oh yeah, C3 I always
Yeah. But there used to be a long time ago, they'd say always stay away from C3. And part of the reason is C3, 4, 5 keep the diaphragm alive, right? So, but sometimes you have to get after C3. Most of the time you can probably carry C3 and C2 together, but you could have a counter rotation. And again, that's where the x-rays come to play, but sometimes that's really tough to feel out because you've got a lot of tissue over the top of those, right? Mm-hmm. So, but if you have muscular spasm on, like the C4 range in there, for example, and a lot of times I'll feel that when I'm doing, checks from the supine aspect. That's when I go ahead and get in there in ribs 2 through 4 and adjust that same side, and that pretty much eliminates almost all the tension. What you'll find is when we do the adjustments, most of the time I leave the mid-cervical spine alone. Really do. Yeah. So if I can focus on occiput, C1, C2, we're good. Go ahead and go in there, C7, typically C6, C7, T1, and those there all tie in with your lower scalenes. Most people, when they go ahead and have a pull in through here, they say, oh, I just pulled my trap. Most of the time it's a scaling. They pull their scaling. And a lot of times the reason for that is because everybody's in this position right now, so they're already hypertonic. So you're already pre-stressed, right? Does that make sense? What else you got for me?
So those